When we talk about cancer, it is easy to think of it as a single monstrous disease. However, this is a common misunderstanding. In reality, cancer is not just one illness. It is a broad term for a collection of more than 100 different diseases, each with its own unique characteristics and challenges. This complexity is fundamental to understanding why fighting cancer is so difficult. These diseases can originate in almost any part of the human body, from the skin on your arm to the intricate neural pathways of your brain. The specific location where a cancer starts plays a significant role in how it behaves, how it is treated, and what the outlook might be for the patient. The core problem in every type of cancer is the same cells that have lost their normal controls. Our bodies are made up of trillions of cells that typically grow and divide in an orderly fashion. They have a life cycle, they are born, they serve a function, and then they die when they are old or damaged. This process is tightly regulated. Cancer disrupts this beautiful, intricate system. It begins when just one cell, or a small group of cells, starts to ignore these rules. Instead of dying as they should, they continue to multiply, creating more and more abnormal cells. This uncontrolled growth is the hallmark of every cancer, no matter where it starts. This diversity means that a diagnosis of lung cancer, for example, is vastly different from a diagnosis of skin cancer or leukemia. Each type of cancer is named after the organ or the type of cell in which it begins. Because a lung cell's job and environment are different from a skin cell's, the cancers that arise from them will also be different. They will grow at different speeds, they may spread to different parts of the body, and most importantly, they will respond differently to various treatments. This is why a one-size-fits-all cure for cancer has remained so elusive for scientists and doctors around the world. Understanding this fundamental concept is the first step toward demystifying the disease. It helps us appreciate the scientific journey to find more effective therapies. When you hear about breakthroughs in cancer research, they are often for a specific type of cancer, targeting its unique genetic makeup or behavior. For instance, a drug that works wonders for a particular kind of breast cancer might have no effect on pancreatic cancer. Recognizing cancer as a collection of many distinct diseases allows us to frame the problem correctly and appreciate the tailored, personalized approaches that modern medicine is increasingly adopting to fight this complex foe more effectively. At its most basic level, cancer is a disease of our genes. Inside every one of our cells is DNA, which acts as an instruction manual, telling the cell how to grow, function, and divide. Cancer starts when this instruction manual gets damaged. These damages are called mutations. A single mutation is often not enough to cause a problem. Our cells have amazing repair systems that can fix these errors. However, over time, a cell can accumulate multiple mutations in key genes that control its growth and division. When these control genes are broken, the cell can begin to multiply without stopping, launching what can be described as a cellular rebellion. This process transforms a normal, cooperative cell into a rogue cancer cell. These newly formed cancer cells do not behave like their healthy neighbors. They do not mature into specific cell types with distinct jobs, and they ignore the signals that would normally tell them to stop dividing or to self-destruct, a process called apoptosis. As these abnormal cells continue to replicate, they form a mass of tissue known as a tumor. Not all tumors are cancerous. Some are benign, meaning they do not spread to other parts of the body. Malignant tumors, however, are cancerous. They have the dangerous ability to invade surrounding tissues and organs, disrupting their normal function. The danger of cancer escalates when these cells gain the ability to travel. This process is called metastasis. Cancer cells can break away from the original or primary tumor and enter the bloodstream or the lymphatic system. These systems are like highways that run throughout the body. By traveling along these pathways, the cancer cells can reach distant organs and form new tumors, which are called secondary tumors or metastases. A cancer that has metastasized is much more difficult to treat because it is no longer confined to one location. This is why early detection is so critically important in the fight against cancer. It is this uncontrolled growth and the ability to spread that make cancer such a formidable disease. The newly formed tumors in distant locations are made of the same type of abnormal cells as the original tumor. For example, if breast cancer spreads to the lungs, the disease in the lungs is metastatic breast cancer, not lung cancer. This distinction is crucial because the treatment will be designed to fight the original breast cancer cells. Understanding this cellular journey from a single mutation to a widespread disease helps illuminate why the battle against cancer is often a race against time. The question of what causes cancer is complex, as there is no single answer. Instead, cancer arises from a combination of factors that can damage our DNA over a lifetime. One of the most significant contributors is our environment and lifestyle. Exposure to certain substances known as carcinogens can directly lead to genetic mutations. Tobacco smoke, for instance, is packed with dozens of carcinogens and is the leading cause of lung cancer. Other environmental factors include excessive sun exposure, which can cause skin cancer through UV radiation, and exposure to industrial chemicals like asbestos or radon gas. Lifestyle choices such as a poor diet, lack of physical activity, and excessive alcohol consumption also play a major role in increasing cancer risk. Infections with certain viruses, bacteria, or parasites are another important cause. These infectious agents can disrupt the normal cellular processes in a way that promotes cancer. For example, the human papillomavirus, or HPV, is a common virus that is the main cause of cervical cancer and is also linked to cancers of the mouth and throat. Similarly, chronic infections with the hepatitis B or C viruses can lead to liver cancer over many years. The bacterium Helicobacter pylori, which can live in the stomach, is a known risk factor for stomach cancer. Fortunately, vaccines and treatments for many of these infections can significantly reduce the risk of developing these related cancers. Genetics can also play a direct role. Some people are born with inherited genetic mutations that put them at a higher risk for developing certain types of cancer. These are not as common as cancers caused by lifestyle or environmental factors, accounting for about 5 to 10% of all cases. You may have heard of the BRCA1 and BRCA2 genes. Mutations in these genes significantly increase a person's risk of developing breast and ovarian cancer. When a strong history of a particular cancer runs in a family, genetic testing can sometimes identify these inherited risks, allowing for increased screening and preventive measures to be taken. Finally, the simple process of aging is one of the most significant risk factors for cancer. As we get older, our cells have had more time to divide, and therefore more opportunities to accumulate random mutations. At the same time, our body's cellular repair mechanisms can become less efficient with age. This combination of more accumulated damage and less effective repair work creates a fertile ground for cancer to develop. This is why the majority of cancer diagnoses occur in people over the age of 65. It is a natural consequence of a longer lifespan, making healthy choices throughout life even more important to mitigate these age-related risks. Because cancer can develop in so many different parts of the body, its symptoms can be incredibly varied. However, there are some common warning signs that should prompt a visit to a doctor. One of the most frequently reported symptoms is unexplained weight loss. Losing a few pounds with diet and exercise is normal, but dropping 10 pounds or more without trying can be a red flag. Persistent and extreme fatigue is another common sign. This is not just feeling tired after a long day. It is a profound exhaustion that is not relieved by rest. This fatigue can be caused by the cancer itself or by the body's reaction to it. Pain is another potential indicator, especially if it is persistent and has no clear cause. While many things can cause pain, a new or worsening pain, such as a headache that does not go away or chronic back pain, should be evaluated. Changes in your skin are also important to watch for. This includes a new mole, a sore that does not heal, or changes in the size, shape, or color of an existing mole, which could be signs of skin cancer. Other skin changes, like a yellowing of the skin and eyes, known as jaundice, or darkened patches of skin, can sometimes signal an internal cancer, such as pancreatic or liver cancer. The presence of a lump or swelling is perhaps the most well-known warning sign of cancer. Many cancers, like breast, testicular, or skin cancer, can be felt through the skin as a hard, painless mass. Swelling in the neck, armpit, or groin can indicate a problem with the lymphatic system, possibly related to lymphoma or another cancer that has spread. Other important signs include a persistent cough or hoarseness, changes in bowel or bladder habits, difficulty swallowing, or unusual bleeding or discharge. It is important to remember that these symptoms can also be caused by many other, less serious conditions. In conclusion, cancer is an undeniably complex and intimidating group of diseases. It begins with our own cells rebelling, driven by a combination of genetics, lifestyle, environmental exposures, and the aging process. Each type of cancer behaves differently, requiring a specialized approach to treatment. However, knowledge is power. By understanding the basics of what cancer is, how it develops, and what warning signs to look for, we can take a more active role in our health. Early detection dramatically improves the chances of successful treatment. If you experience any persistent or worrying symptoms, do not ignore them. Talk to your doctor. It is the most important step you can take.